The Shipley and McAfee rating scales, located in the fourth edition of the Assessment in Speech-Language Pathology.
Fluent speech flows in a rhythmic, smooth, and effortless manner. Disfluencies are disruptions of fluent speech. Some characteristics of stuttering include developing for no apparent reason, higher prevalence in boys, genetic predisposition to stuttering in some cases, stuttering can be variable, and it causes personal grief, fear, and frustration. When evaluating a client for a stuttering or cluttering disorder, the speech-language pathologist must consider many factors and discern whether the presenting problem is a true disorder or a case of normal disfluency. The most important procedure for an evaluation of stuttering is a speech sample. The Shipley and McAfee provide several forms in order to get a complete and thorough evaluation of a stutter.
The objective of an assessment is for the clinician to gather as much valid and reliable information about the client and process this information by making your best clinical judgment or decision. In order for the assessment to be valid, it must truly evaluate the intended skill or communicative behavior of interest. The term evaluation is synonymous with assessment, whereas each process is constantly ongoing. Upon the completion of an assessment, a diagnosis is determined. SLPs use this information to draw conclusions, identify for referral, identify need for treatment, determine focus of treatment, determine frequency, length, and structure of treatment. For an assessment to be meaningful and useful, it must have foundational integrity. This includes thoroughness, a variety of assessment modalities, valid collection of info, and reliable information gathered. This means the data should reflect the client's communicative abilities and disabilities. The repeated evaluations should yield the same results. Finally, the assessment should be tailored to the individual client. It should be age and gender appropriate, and at the client's skill level. Also, it should be sensitive to their ethnocultural background.
Jessica is a 7-year-old girl who is in the 2nd grade. She lives with her mother, father, and 10-year-old brother Joey, and English is the primary language spoken at home. No other family member has had speech and language issues. Jessica's mother had a normal pregnancy. Jessica was behind on meeting speech milestones, including producing her first words at almost 2 years old. Her parents had become increasingly concerned with her severe disfluency while reading and speaking to unfamiliar people. She also stutters during conversational speech. Jessica comes home from school very upset about being made fun of by her classmates. Jessica is starting to refuse to read in class rather than attempt the reading asked of her. She developed her stutter at 3 years old. Jessica's family always believed that she would grow out of her stutter like other children, but now at 7, her stutter has become severe enough that it is affecting her life in school as well as home. Jessica's stutter can be characterized by repeating a word or phrase, tapping her hand on the table while reading, and prolonging a sound or word. Her parents are hoping that with speech therapy, Jessica's stutter will improve. Hi, I'm Michelle, the speech language pathologist. What brings you in today?
Well, my daughter Jessica, she's 7 years old.
Okay.
She has some stuttering behaviors that can be pretty severe at times. I've spoken to some family members about it, and they've always assured me that she would grow out of it, but she hasn't yet. And she's starting to get bullied at school, so I figured it was time for her to be seen by someone professional.
Okay. This is the parental speech chart that for the next week or so, take note of Jessica's stuttering and just fill it out and bring it back next time.
Okay.
This is also the modified S scale. It's directed towards the stutterer themselves, but you can replace every I with my child. They're just true or false questions. Bring that back next week as well. Do you have any questions with those?
Nope.
So next week when I do the language sample with Jessica, we can review all the things that we took note of.
When assessing stuttering, it is important to assess feelings and attitudes. Stuttering frequently causes feelings of pain and frustration. People who stutter often experience corrections, teasing, and pity, as well as being mocked, avoided, isolated, and scorned due to their speech disorder. Negative emotions towards their stuttering are likely to result and should be assessed using forms such as the modified S scale and the parental speech chart. Parents of children who stutter are likely to have fears, anxieties, and concerns of their own related to their child's stuttering patterns. It is important when assessing stuttering to consider these emotions. The parental speech chart can be completed to assess parental level of concern. The parent must take note of the child's disfluencies and the factors surrounding the disfluency, such as the presence of tension, who the child was speaking to at the time of the disfluency, the topic of conversation, and more. The modified S scale is a form used to assess stutterers' attitudes about various speaking situations. Understanding a client's feelings and attitudes about their stuttering may be helpful in making decisions about therapeutic direction. When completing the form, the client is asked to respond with true or false to a series of 24 statements. For young children, this form can be adapted and completed by a parent by changing I to my child and should be completed from the child's point of view. This form can be administered over time to assess progress. There is a form similar to the modified S scale specifically for the use of adolescent age clients called the Adolescent Communication Questionnaire.
Hi, my name is Michelle, and I'm a speech language pathologist. What's your name?
Jessica.
What grade are you in?
Second.
How's school?
Good.
Do you have a favorite subject at school? No? That's okay. First thing we're going to do is that I'm going to have you read a couple of pages from this book. Just do the best you can. We're going to start on the first page.
One day when Mickey Mouse was driving along in his car, a plane whizzed by above him. Gosh, look how fast that plane flies. Gasped Mickey. I'd like to zoom across the sky too, and I know just how I can do it. I'm going to take flying lessons.
Good. I'm going to read you a story about these pictures. After, I'm going to ask you some questions and just tell me as much as you can remember. One day, when Lydia was watching television, an amazing thing happened. The animals on the screen came to life in her living room. A bear, a monkey, and a lion were looking right at her. Lydia was very scared. She tried to yell for her mom, but nothing came out of her mouth. Then the animals started talking all at once. Finally, in a quiet voice, she said, "Where did you come from?" What happened to Lydia while she was watching TV?
The animals came out of the TV, and she was scared.
Good. What did Lydia ask the animals?
Lydia asked, "Where did you come from?"
Good.
The overview of assessment includes the history of the client. The procedures involved in getting the history of the client includes a written case history, information getting interview, and information from other professionals. Other contributing factors to the client's history may be medical or neurological factors, family history, sex, motivation, and levels of concern. The assessment of stuttering and cluttering procedures include screening, speech sampling, and stimulability. The analysis for assessing stuttering and cluttering includes disfluency indexes, associated motor behaviors, other physiological factors, rate of speech, feelings, attitudes, and reactions to speech. Additional aspects of the assessment include oral facial examination, speech and language assessment, hearing assessment, determining the diagnosis, and providing information, whether it's a written report or an interview.
Form 10-4 is the assessment of associated motor behaviors. It is designed to help identify these extraneous movements. Note that the form lists the most common behaviors. It is not an exhaustive list of all the possible behaviors clients may exhibit. Once the behaviors are identified, chart their frequency in the same manner other disfluencies are charted. A client may also exhibit abnormal physiological behaviors associated with stuttering. These may affect respiratory, phonatory, articulatory, and prosodic aspects of speech production. Form 10-5, Assessment of Physiological Factors Associated with Stuttering, is provided to help identify several physiological factors that may be observed during an assessment. Clinicians need to carefully examine whether these factors are present during fluent and disfluent speech or only during disfluencies.
A disfluency index refers to the percentage of disfluent speech present in a speech sample. Disfluency indexes should be determined in several different environments, such as the therapy room, outside, at home, and at work, within different modes of speech, such as reading and spontaneous speech, and across more than one assessment session. The Fluency Charting Grid, Form 10-1, is used to count the total number of disfluent and fluent productions and to code each disfluency type. Form 10-2, Frequency Count for disfluencies, can be used to tally occurrences of each type of disfluency. Form 10-2 may be preferable for charting short samples or more informal chartings such as screenings. Both Forms 10-1 and 10-2 are methods for identifying and quantifying disfluencies. After tallying the occurrences of each disfluency, use Form 10-3, calculating the disfluency index. When determining a disfluency index, count each repetition of a sound, part of a word, whole word, or phrase only once. A total disfluency index reflects all disfluencies produced by the client. For example, consider a 500-word sample with the following number of disfluencies: 75 repetitions, 50 pauses, 25 sound prolongations equals 150 total disfluencies. To calculate the total disfluency index, count the total number of words in the speech sample, which is 500 in this example. Count the total number of disfluencies, 150. Divide the total disfluencies by the total words. 150 divided by 500 is 0.30. Change the number to a percentage, which means 0.30 is 30% total disfluency index.